Okay, perfect. Well, good evening, everyone. Today is January 29th, 2025, and it is 4:02 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Is Manager Jones online? Okay. Manager Jones, can you hear me?
Yes, I can. Thanks very much.
Okay, perfect. Thank you. I would like to announce that in order to make it more accessible to community members, we will hold public communication for the Budget and Finance Committee, Executive Committee, and the Board of Managers meetings at times certain of 5:30 p.m. unless a member of the public wishes to comment on a specific item on this agenda. Do we have anyone?
Yes, we have one person, a resident, that would like to speak at 4 p.m. today.
Okay. Can you, Yesenia, can you read her or him, whoever? So.
Yes. So this evening's public communication guidelines go as follows. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number after your introduction. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received one submission for this evening's public comment, so at this time, I will welcome Rosanna Youssef to unmute, who is joining us online.
Thank you.
Hi.
Hello, Rosanna.
Hi.
Hello, Rosanna. You have 3 minutes.
Okay. Yeah, so as Yasin introduced me, my name is Rosanna Youssef. I am a licensed professional counselor in the state of Texas. I'm also a Palestinian American and a Muslim, and I'm completely new to these meetings, just heard about it recently, and just wanted to introduce myself and maybe be a voice for my community from the, I would say, mental health perspective. Um, kind of bring maybe awareness to the challenges that our community goes through health-wise, and perhaps express a desire in the future to work with the Central Texas health system on advocating for resources that can go towards helping our community and the unique challenges that they face. I would also like to express that tomorrow I will also be at Austin City Council speaking to the public comments there, advocating as a Palestinian for the rights of one of our Palestinian healthcare workers. His name is Hussam Abu Safiya, who has been imprisoned, just advocating for his release, just trying to keep the connection between healthcare workers locally and internationally, advocating for their rights and our rights. And I just wanted to mention that as well as something that is very important to me and my community and others of us in the healthcare sector. So I wanted to thank you all for letting me speak early and introduce myself. And I hope to maybe further build up on these ideas in the future with the central health system. But that's about it.
Thank you so much.
Thank you.
Thank you, Rosanna. And that concludes this evening's portion of public communication. Thank you.
Thank you. Well, members, before we begin, I want to take a point of privilege and speak from the heart, because this is a bigger than just a meeting. It's about our shared responsibility. Muhammad Ali once said, "Service to others is the rent you pay for your room here on earth." I stand before you today not just a board member, not just as treasurer or chair of the Budget and Finance Committee, but as a public health advocate, a woman, a mother, a Palestinian, and a Muslim, someone who has dedicated her time and expertise to improving health. Public and community service is not easy. It demands resilience, integrity, and an unwavering commitment to the truth. Lately, I have felt the weight of efforts to discredit me, not because of wrongdoing, but simply for daring to exist in these spaces and for my voice, for advocating for public health, for refusing to shrink myself as a woman, for being Palestinian and speaking on injustices. But let me be clear, I would not be deterred. My work is rooted in amana, an Arabic word meaning trust and responsibility. It is a sacred duty to serve with the highest level of integrity and ensure that the most vulnerable amongst us are not overlooked. Serving on this board is not just a title, but a responsibility that I don't take lightly. It requires time, sacrifices, and a deep commitment to making informed decisions that impact people's lives. It means showing up, being present, and respecting each other's time by ensuring our meetings start and end with purpose. Last week, I spoke to a group of young students who aspire to be in our roles. I asked them to reflect on their why. It reminded me of my own. Why I do what I do. Because when we have clarity in our purpose, we find the strength to stand tall, even in the face of adversity. I shared a few lessons that I've learned along the way, lessons I want to share with you. Authenticity, staying true to who you are, even when it's difficult. Commitment, following through on your purpose, no matter what the obstacles are. Kindness and empathy, treating others with dignity and respect, even when we disagree. We may not always agree, but respect should never be conditional. Our work is bigger than any one of us. It is about the people who rely on us, on the communities that trust us, and the future we are shaping together. Right now, we are facing unprecedented challenges, budget cuts to critical programs and services, threats to life-saving research, and policies that will impact the health and well-being of our communities. In times like these, unity is more important than ever. Division will not move us forward, only unity will. So I ask you all to move forward with a shared purpose. Reflect on your why. Because mine is clear, to make a difference, to improve lives, and break down barriers. Let us commit, not just with words, but with our actions. Because at the end of the day, service is not just a responsibility, it is the rent we pay for our place in this world. Thank you. And I will proceed with our agenda.
I want to thank you, Manager Mustaita, for speaking out and speaking from the heart.
Thank you.
Thank you.
And now proceeding to our committee agenda. Agenda number 1, approve the minutes of the December 11, 2024 Budget and Finance Committee. I move that the committee approve the minutes of the December 11, 2024 Budget and Finance Committee. Do I have a second? Manager May seconds. Any discussion? I see none. All in favor?
Aye.
Thank you. Motion moves. Thank you. Item 2, receive the November 2024 and December 2024 financial statements for Central Health, including capital projects and certain legal expenditures. Members, there will be no presentation on this item. Materials are in the backup, and staff are available to answer questions offline. And also, I understand the financials for January are not yet. Jeff, do you want to just touch on that?
Yeah, thanks. Jeff Canoga, Chief Financial Officer. We do not have packet information. We will bring the financials back at the next board meeting for November, December, and January.
Thank you.
Thank you.
Now, item number 3, receive a presentation on the review of the Central Health Fiscal Year 2024 financial audit. For this item, we'll have Nikki Riley and Panja Patel with Maxwell, Locke, and Ritter who will be presenting. Members, I know we're delighted to know that we have a great audit report. There's not any findings, and so that's really the overall highlight, and that really pertains to the great work that our financial team is doing. So Nikki, if you want to start.
Thank you. Nikki Riley.
Yes, Manager Valdez.
Just clarification, is this only regarding the central health audit, not
Yes.
the performance audit?
Correct.
Correct.
Okay.
It's only Central Health.
Nikki Riley, Deputy CFO. Ms. Patel from Maxwell, Locke and Ritter. I just want to, like you did, Manager Yusuf, just give kind of an overall summary of the audit. As you said, we had a clean opinion. The best opinion you can get is called an unmodified opinion. There weren't any findings. We didn't have to make any changes to any of the journal entries or records that we had already given to MLR. We didn't have any internal control deficiencies, which is in the presentation, and they had no disagreements, fist fights with management, which is always good. As you'll know, the entire report is not attached. This has happened in the past as well. We're trying to make it pretty. We're dotting our I's, crossing our T's. But the meat of it is the numbers, and those are in this presentation. And if you have any questions on those, definitely can take those.
Thank you, Nikki.
Thank you. I am Poonja Patel. I am audit partner at Maxwell, Locke and Ritter. I'll quickly just tell you what the rest of our audit team engagements names. Elise Missé was the audit manager responsible for primary review of fieldwork. Garrison Clark was the senior audit associate responsible for fieldwork of the audit, and Jimmy Rommel was the concurring partner on the engagement. All three of those individuals have CPAs and are licensed to do government audits under Yellow Book. So we did audit the financial statements of Central Health and the supplemental information as of and for the year ended September 30th, 2024. Included in the financial statements is our independent auditor's report, as well as the MD&A. It will include the basic financial statements. And then I'll point out that there's also component units that are included, and these are discretely presented in the financial statements. Those include Community Care, Sendero Health Plans Incorporated, and Community Care Collaborative. The Community Care audit report for this time period was approved yesterday in their board meeting, and so they'll be issuing their final report within a day or two as soon as we get their management representation letter back. So we'll go over some of these things in a little bit more detail, but for time's sake, it's going to be very high level. There'll be time for questions, and I'll kind of reiterate some of the things that Nikki mentioned, some of the good news. So. The first thing that we issue in the report is the independent auditor's report. This is our opinion of the financial statements. It is addressed to the Board of Managers. At the very top is the meat of that letter. It is our opinion. We noted that the financial statements in all material respects were in accordance with US GAAP. So that is considered an unmodified opinion or a clean opinion, and this is really the highest level of assurance we can provide. So, good news number one. The next slide also reiterating what Nikki said. We did not identify any deficiencies in internal controls that would be considered material weaknesses. The next 3 bullet points are just some verbiage that we would use if there were some from deficiencies versus a material weakness versus a significant deficiency. Those do not apply to the organization. And then in addition, as a primary government, the organization is responsible for certain criteria under government auditing standards, and we did not find any instances of non-compliance in that area. So all good news, and the rest, we'll go over the financial statements in a high level more for informational purposes. So the first is a statement of net position. This is similar to a balance sheet, summary of your assets and your liabilities. And I'll just point out this is the primary government, so just central health, not including the numbers of the discrete component units. So you'll notice total assets increased by 118 million. This is primarily related to the short-term investments balance that increased by 72 million, related to more tax dollars that were able to be used for investment purposes. Current liabilities increased by 24 million, a combination of just timing of payments made towards year end. So AP increased by 12 million, and IBNR's accrual increased by 6 million. We also noted that net investments in capital assets increased by 20 million during the year. That was really related to some of the construction projects that Central Health is a part of. And so all to say the net position ended up at approximately 830 million at year end. Moving on to the statement of revenues, expenses, and changes in net position, very similar to a P&L, a summary of revenues and expenses. Kind of broken up into 2 different slides here. The first slide here is the operating revenues and expenses. So operating revenues decreased by 3 million, and this is mainly related to in the prior year there was a grant income that we didn't have in fiscal year 24. Operating expenses increased by 70 million, largely related to increased professional fees for healthcare delivery of 28 million and 21 million related to personnel expenses, so your salaries, wages, and hiring. And then there was a $13 million increase to the UT affiliation expense, going back up to 35, similar to what it was in 22. Moving on to the non-operating revenues, still in the same statement of revenues, expenses, and changes in net position. Non-operating revenues increased by 55 million. This is primarily related to the tax revenue. There was a 34 million of that's related to the tax income due to higher rates. And investment income also increased, as I noted. We had higher investment balances, which with the combination of volume and better market performance, that increased by 26 million. And then there's new this year, there was an opioid settlement revenue, which is going to be primarily restricted for opioid remediation efforts. So that's a summary of that. I just wanted to kind of point out some financial highlights. No new accounting policies, so no policies to discuss today, but we did want to know, as part of the government auditing standards, Central Health's bank balances were fully collateralized and protected by FDIC at year end, and the investments were in compliance with the Central Health investment policies and the Public Funds Investment Act, which is required. And then I'll just note that Central Health does have a general obligation bonds of 166 million, approximately, of which 8 million in principal will be due in fiscal year 25. And then with what we issue, we will also be issuing a governance letter that will again be addressed to the Board of Managers. It's a required communication for us to provide to the board. If there were any new accounting policies, we would have discussed it in that letter. We will note that there are no new policies adopted in fiscal year 24. Again, no difficulties, disagreements, or significant adjustments that were booked as a part of our audit. You know, this presentation here is about 10 slides, the financial statement's 30 to 40 pages, but our request list is closer to 200 items. We asked for a lot throughout our audit process. We start in November. We work till pretty much today on making sure that we all have everything we need to be able to issue those clean opinions. And so we really appreciate the working relationship, the responsiveness, kind of the clean work products that we get from the team. Really impressed with them, and we get to work with a lot of clients in the city, and so we really love working with Central Health and the team here. So
Thank you so much, Imogen. Thank you for that report. Appreciate it. And thank you to our staff for doing all the hard work and for your communication and responsiveness and for obtaining a clean audit. So thank you for that. Do you know when the report will be available?
I think probably in the next couple of weeks.
yeah, for us, it's really what's left is
lengthy.
For us, we're just wanting to get their inputs, incorporate them. Once we have those, we can turn it around pretty quickly. So it's as soon as we can get some input. on
Okay,
some of them.
perfect. So once it's available, if we can post it online, available for the public to view. Thank you. So I am going to go around to see if there's any questions with from board members. Manager May, do you have any questions?
No questions, thank you.
Oh, and I forgot. Manager Jones is online. Manager Jones, do you have any questions about the audit?
I don't have any questions, but I just have I just was wondering, in our audit, do we assess, and I'm not sure if this is the right place to ask it, do we assess number of clients that we may be seeing outside of our jurisdiction that we're providing services for and the costs that are being incurred in that? Is that assessed through any of our financial audits?
No,
Nikki's gonna-
this is a financial statement audit. They look at internal controls just to make sure that we're putting things in the right place when we publish our financial reports to users. That's what their audit is. They don't go in and audit to see whether we're actually giving services to residents outside of the county.
Okay, then. All right, thanks.
Thank you, Manager Jones. Manager Mawani?
Thank you.
Thank you. Chair Kitchen?
No, thank you, no questions.
Thank you.
Just congratulations.
Thank you. Manager Brinson?
No questions.
Thank you. Manager Martin? Manager Valdez?
I do have a question, and it's maybe maybe it's out of your jurisdiction to be able to tell us, but I'd like to know if we in fact had a performance audit done, do you all get a copy of that or take into consideration what discrepancies may have been raised in the performance audit as opposed to our regular audit that maybe have not necessarily been indicated previously or that we can address?
So I'm not 100% sure what the performance audit with the.
It's Mazar's report that they completed recently.
Okay.
So the Mazars report does have some notations in it about us coming up with a policy regarding.
Well, different
internal
things. It has
control,
different
things.
Right.
We didn't go over that with them. We do the things that the Mazars report wants us to do with them. And so there were some things in the Mazars report that it said we needed to do that we actually are already doing. And so in that instance, I've already gone over the list of things that Mazars had told the finance department that they need to do. The majority of them are already being done. There were a couple of things that are just, they wanted us to put in a specific policy. Sure, we're doing those things.
Okay.
So, yeah, we'll put it in a policy.
Okay, then not to ask you or not to take us down that rabbit hole, but I was just wondering, Nikki, if this was appropriate for me to ask if there were outlines and then you all have a resolution for those things. Can you provide us a copy of that?
I am not in management of that copy. I know it's being worked on, not by the finance group though, but I think at some point it's gonna come back with
Well, then
status.
if you can't answer it and there's nobody here that can respond to that, then I'd like to make sure.
Monica can.
Okay.
Excuse me. Thank you. Hi. I think based on the presentation, and I can't remember, so much has happened, I think that Katie Coburn and I made in November, December.
Right.
That we are committed to bringing that back to y'all in March. And we are diligently working with that. There's a spreadsheet. It's got the recommendation. It's got where we are on it. It's got who's responsible.
Well, it starts
for
with, it starts with the citation. This is what was stated, this is what we are doing, okay?
So,
Or whether or not there's a plus or minus policy change. Thank you.
Okay.
I appreciate it. If
So-
it could be provided to us in that format.
So
Thank
in
you.
March, you said?
March.
Okay, thank you so much. Thank you, Manager Zamora. Okay, thank you so much, appreciate it.
I think there's action requested on.
Is there? Sorry,
to
I may have
accept
missed it.
And recommend acceptance to the board.
Yes, please go ahead, Manager May. Where's my motions?
I move that the committee, I move that the committee recommend that that the Board of Managers accept the 2024 financial audit.
Thank you. A second? Manager Brunson? Any discussion? No? I see none. All in favor?
Aye.
Aye. So the motion moves unanimously. Manager Valdez abstains.
Abstain pending more information.
Okay. So is anyone else abstaining? No. So only Manager Valdez is abstaining. Thank you.
I do have a comment that maybe I should have made it when we were doing, but if I may, and y'all can tell me if it's inappropriate, that it does fall in the realm of where we are in the agenda. But I just want to highlight that I believe this presentation, both orally and with respect to its slides, is a beautiful example of the kind of presentations that I believe we ought to be getting. High level, hits the highlights, gives us an opportunity to see what, potentially we want to go back and ask questions about. And if we need more information, of course, we can always come back to the appropriate staff. But the beauty of this is a very detailed document of the work that you did, but yet we were able to go through it pretty quickly. And I just want to tell us as a board that this is a good example of what we should be trying to follow for us as a board and also for staff.
Thank you, Manager May.
Thank you.
We all, I believe,
Thank you for-
concur
for-
with that. Thank you. Okay, thank you. Now moving on to agenda item number 4, receive an update on information related to Central Health Enterprise compensation philosophy. So, members, I wanted to bring your attention to this item. This item that we are going to be starting more of a conversation right now, it's about really my overall arching goal that we are compensating our staff and executives fairly and equitably based on their expertise and credentials. So we want to know what are the benefits, how they're assessed, and so that is really the start of our conversation this evening. And also, I certainly believe we need to take care of our people, and which means our staff, in order for them to deliver good, high-level, high-quality care and services to our community. So this is just really the overall picture of this item, and Jeannie Verdon, who's our Chief Human Resource Officer, will be presenting. Thank you.
Good afternoon, Jeannie Verdon, Enterprise Chief Human Resources Officer. I apologize this wasn't sent out in advance, however, you do have a copy in full at your seat. So really, we're gonna talk about a portion of our total rewards philosophy. Next slide. So total rewards is a combination of compensation, benefits, paid time off, retirement, matching investments, and investments in professional development, among other things. So really, how are we, to manager's point, how are we providing a whole package that meets the needs of our team members? So we're gonna be focusing on our compensation philosophy specifically. There is a compensation philosophy that the organization does have. By way of background, it was originally created and approved by the Board of Managers in 2007. It was then brought back in 2020 and updated with the Board of Managers and approved in October. And in 2025, in the next couple of months, we'll be bringing it back again with some edits for your review and approval, and really trying to transform it from a compensation philosophy into a total rewards philosophy. The goals of the compensation philosophy are to align with the mission, purpose, and values of the system, balance our fiscal responsibilities with the need to attract and retain top talent, and to recognize the importance of key talent to achieve our mission and strategic plan. Compensation program elements. So again, we want to offer competitive pay within our labor markets. We want to ensure that our pay practices are equitable and inclusive, both internally and externally. Our pay is based on job-related skills, duties, certifications, and performance achievement. The compensation philosophy targets salaries around the 50th percentile of the external market, with variations for skills, experience, performance, and impact. However, there are certain direct patient care roles or roles with shortages of available local talent, which we might actually extend up to the 80th percentile of the external market. An example of that would be our medical assistants. So how do we determine market position? We use multiple salary surveys to determine market position, including but not limited to Comp Analyst, our SHRM surveys, the Warren Report, Connexa, Comp Data, ERI. Those are just some of those. We also use MGMA, and we can use outside consulting firms. The analysis process, jobs are matched not just by titles, but also by duties and other qualifications for the role. We review the local market to understand the current demand for the level of the job. We review the compensation ranges from the various sources, and we assign the compensation for the role. Once we determine that we need to make an offer to a top candidate, we review the candidate's qualifications and determine the appropriate level for the offer, which I'll review in just a minute. So again, in our compensation program, we can take any resume and we can redact personal information around it. We're looking at the skills and qualifications, and that's what we base the offer of on the market that we have aligned it with. So for example, next slide. This is an example of what our compensation philosophy looks like. So if you're at the entry level, so you have no experience or up to almost 2 years of experience, your compensation would be at the 40th percentile of the market. If you have between 2 years and almost 5 years of experience, you come in at the intermediate level, so you would be paid at the 50th percentile of the market. If you bring 5 years or more of credited years of experience, you would come in at the career level and you'd be at the 60th percentile. So in this example, again, we look at each job individually and price it based on the duties and qualifications that job requires. So you can have 3 or 4 more positions that are alike, such as at the director level. However, they would be comped differently because they are based on what is required for that specific role.
I can interrupt you here.
Mm-hmm.
So you're talking about years of experience. What about credentials and degrees? So does that
So that would
surpass-
determine, when we're looking at the market analysis, that would determine the 50th, 60th, and 70th percent, 40th, 50th, 60th percentile. So we look at the duties, the qualifications, how many years of experience it would have, supervisory responsibility if it requires a certification or a license, for example, like an RN. All of that is included when we're looking at the job analysis portion of it before we assign compensation. Okay.
So is that the end of your presentation?
No, just a few more slides. Next slide. So how do we adjust our compensation? We have 3 main ways. First and foremost are our performance evaluations, which are conducted at least annually for all team members. So those are based on previous performance period and includes evaluation on our values, the job description requirements, and individual goals. So the results of the performance evaluations tie into our merit increase process. Next. We also do market adjustments. With the exception of executive roles, we benchmark all jobs annually to determine if adjustment is needed to remain competitive. At the same time, we also look at level adjustments. So for example, if you come in at the entry level and then you now have 2 years of experience, then we would adjust you up into the intermediate level. Same thing, if you hit that 5-year mark, we would adjust you up into that career level. This investment underscores our commitment to recognizing and rewarding career experience within our organization. Next slide. We do have market-driven benefits, so they are market-driven. We fund some of these benefits. Some are self-selected, or there's a portion of an employee that has to pay. But our benefit offerings include medical, dental, and vision insurance, and there's multiple plan options to meet the needs of our team members. We have flexible spending accounts and health savings accounts. We have life insurance and disability programs. We have retirement plans, an employee assistance program, legal services. We have paid time off, paid holidays, child and adult care assistance, well-being days, and leave of absence plans. We're actually kicking off open enrollment on Monday for our team members for this benefit plan year, and we were able to enhance some of the benefits that we provide. And our total rewards commitment, we are dedicated to providing a competitive and comprehensive total rewards package to attract, retain, and motivate our valued team members. We are an equal opportunity employer, and we still remain committed to creating an inclusive space and respectful work environment where everyone can be their authentic selves.
Thank you.
Thank you.
Thank you, Jeannie, for that presentation. Before I entertain any questions, I think the whole essence of this is transparency. We need to be very transparent to our public and to also to ensure we are compensating fairly and justly. But also, before this meeting, I had a meeting with Jeannie and Chris, who's oversees benefits. Now, Central Health is unique in terms of the services and also in terms of the community focus. And I want, as you're going to come back to us, that some of the positions that you have, even though they're whatever market value, but the impact they deliver to our community should also align with that. Because there seems to be some who I felt, me in the chair, that needed to, they have really great impact, they're face forward, and are really, overall, Central Health focuses on community engagement and reaching our population, meeting them where they're at. So whatever your future presentations will include that component, and that is something that I think we all aspire to see moving forward. Now, I am going to open the floor for any questions related to this item, and know this is the start of a conversation, and we hope to bring it back and to be more transparent to everyone. Thank you. Any questions? Manager Valdez? And I'll take you, Manager Jones, after her.
Oh, no, do Manager Jones first.
Okay. Manager Jones?
I'm not trying to be trite here, but as I look through the presentation, and perhaps, hopefully I missed it. But if we were carrying this presentation out to the general public, I don't see a lot of diversity in the representative and the children that were modeled as future providers. Did I miss something there?
That's a great point. I actually did not, so we'll take that definitely into consideration. Thank you, Manager Jones.
Well, I think it says more about us than it does about the children. Yeah. And I just want to elevate it that these are the kinds of things, despite DEI, that we are still supposed to be considering as we manage our health services.
Absolutely.
Absolutely. Thank you so much for that. Thank you. And that is why it's so important to have the diversity of voices on such boards.
Right. Absolutely.
Do you have any further questions or comments? I see not. Manager Valdez?
Shannon, we wanted to make sure that you didn't have any other questions.
No, I have no other questions.
Before I start speaking. Okay. Mine's going to be relatively quick. Thank you for bringing that up, but I'm hoping that the future presentation is going to give us each a better idea of, I want to see, if this is for the enterprise, then each component of the enterprise does different things. So CUC, Sendero, and Central Health are all doing different things. Mm-hmm. And what I'd like to see is a breakdown of the organizational charts that, again, talk about the job titles, responsibilities, and salaries for each of those, and that gives us an indication as to what the demographic breakdown is of people that are in those positions. And that's from the top down or from the bottom up, so that we have a feel for what those facing forward people look like, and who are the people at the top that are making the decisions for managing what policy decisions or strategies may be implemented to affect the quality of service received by our patient. In addition, I'd like also, when we're getting that analysis, we can use that to see whether or not, because I'm especially concerned about the medical providers. I want to see what we're paying our medical providers, based on what, and I'd also like to know whether or not this is where on the market, based on who did that study. Okay, I don't know if that makes any sense, but so here we are, composite of the enterprise. However, it's broken down: Sendero, Central Health, and Community Care.
Okay.
The decisions, descriptions,
So-
the job titles, the job description, and the income, the salary, and then tie that to, I guess, the demographic, and then how does that compare along the line in the market? Do you understand?
I do understand.
So that
So
it's a
let me-
real comparison. It's pretty comprehensive. But it's like I said, I have been waiting
But-
for this since Susan was still here, and
Thank you for that. Now, as I mentioned, this is a start of a conversation. We cannot provide all that information
I
at once,
understand.
so we will try to
No,
bring
I'm-
in gradually. I think we're trying to achieve the same goal of transparency and numbers. And this is something that we will bring back, and I think the whole idea is to be very transparent but we wanted to provide context. How are those numbers derived? And this is something that will come back to us. As you mentioned, you had few years back that with us, the board, voted on some of the policies.
Yeah, the compensation philosophy.
Yes.
So yes, we want to bring that back, again, to transition it more to a total rewards philosophy. So we will bring that back for review and consideration and approval with the board. And then I just do want to caveat, we have over 2,000 team members and over probably 250 plus jobs. So granular might be a little hard. However, can we work through a demographic report for various levels? We can absolutely do that and bring that back later on.
I appreciate that. It was my understanding we had 915 employees, but maybe that's just for
Well,
Central Health.
So,
System-wide, we're well over 200,
2,000.
2,000. Sorry, yes.
So that says something to me, and knowing where they are, and what they're doing, and what we're paying them is important. Thank you.
thank you for that. I think right now, initially, we're going to start with executives, and we'll move our way down. So that is really the intent for us. So any further questions on this item? Chair Kitchen?
Jeannie, do you, is there an equity component in how you set salaries? I don't know if there should be or not. I'm just wondering how you double check for equity? Does that make sense? I mean, I know we want equity and diversity in terms of our employment, you know.
Right.
So we do things to make sure that we're paying attention to that when we hire. Does that, is that play in any way in terms of how we look at the salaries?
No, we really look at the salaries based on the qualifications of the individual. So again, we could bring forward a resume, redact all of the identifying information, and we could have 3 very similar resumes, and we would be looking at the exact same things. So if they all had the same amount of years of experience and they were 5+ years, they would all get the career level. So when we talk about equity within pay, we're really looking about internal equity. So ensuring that someone who has 5 years of experience is not getting paid less than someone who has maybe 1 to 2 years of experience. If we're going to be adjusting salaries for any reason, making sure that, again, there's an equitable component so that the more tenured, experienced team members are not paid less.
If I may
Okay.
for a moment, I think I understand the intent of the question,
Okay.
and what I think you'll actually find that we should demonstrate is that I don't believe there are any inequities based on gender or race or ethnicity and so on, that because this is our philosophy, the differences track back to qualification, years of experience, and so on. But I think we ought to potentially just ensure, let's check that and let's bring it back to the board so you can see, for example, that men and women with equivalent years experience and qualifications are paid with full equity. So let's work on that. I think we just it's so embedded in how we compensate that we haven't been describing it that way, but I think we could for the board's just confirmation.
So,
yeah.
thank you for that, Dr. Lee. I think once there's numbers presented to board members, they may have a different assessment in terms of equity. So just to let you, like, I'm gonna be very honest to the board here, and I know, something you know about me, I'm open book, I'm transparent. I did have a look at at the executive level salaries. There was some discrepancy, so so just wanted to make that aware. Again, this is something that I want us to work hard on as an institution.
My second question is, the factors that we look at when we do the market. When we do the market, we compare, and that helps guide us. I think also it will be important as we get to that point to think if there are some other criteria that are unique to us as an entity that we might want to use. So for example, we are a community-focused, tax-paying public entity, and that could impact how we emphasize certain positions that might be important to the community, or levels of salary. I've seen that kind of conversation happen before, where we think in terms of community is very important to us, so we might, normally if I've got this right, we look at certain percentile, 50th percentile, 65 percentile, or whatever percentile of the analysis that you do, which is an average. We could talk in terms of, or think in terms of, for certain positions that we feel like are particularly important given the type of entity we are. Mm-hmm. We could discuss, I don't know if we need to do this or not, but we could discuss that perhaps that one ought to be at a higher percentile.
So we do have that in place currently.
Okay.
So again, that was back, if you go to the presentation, when we're talking about
Okay.
those mission critical positions.
Okay.
Or those positions that there is a shortage in the labor market.
Okay.
That we do have the ability to pay at a higher level. So there's a lot of our frontline positions, and the example I brought forward was really the medical assistants.
Right. Uh-huh.
So that is just one of the positions that we do pay at a higher level, just given the critical nature of what they do for our care teams and how they are, again, we need to recruit and to be able to retain those positions. And that's just one of an example.
Okay, that's great. That's one of the things I want us to have the flexibility to discuss and think about. And I have one last point, if you want to take someone else first.
Is it quick?
Yeah.
Okay.
The last point is one that I have just forgotten. So go ahead.
Sorry.
Mine was just a follow-up to what she said.
Let me see if there is any other board members who have any questions, Manager May, and I'll come back to you.
Since we're kind of getting into the weeds on this one, I'm going to go ahead and go there too. I am interested in learning, and this is like a different kind of a job. It's like a job audit, basically, auditing the jobs that are in place. Mm-hmm. I'm interested in learning if the current positions that we have now, particularly at the top, if those are congruent, if that position's, what the position is, and then what that position is doing, that person or these people that are in those particular positions, are those congruent with their actual responsibilities? In other words, do we just have somebody with a high title, but the responsibilities don't match with the title? I'm interested in learning a little more about that.
Certainly. That is our goal. It does go through a review process. We do rely on the managers to provide us with the job duties and responsibilities, but part of the responsibility of the compensation team is to review that and to make sure that that does align with, kind of to your point, the title, if it's at a director level, are these director level duties, so on and so forth. So I would like to say, yes, that job audit is happening and that is current. However, with anything, nothing is 100% certain, and there might be some job duties that we need to go back and look at that haven't been updated in a while, and the job duties have changed. So we're going through that review now, and putting into place a job description review process to where the job descriptions are reviewed every 2 to 3 years at a minimum. But certainly anytime if there's a individual role that, like a director level role there's only one person in that role, when they leave for whatever reason, then we do ask the managers to go in and to reassess the jobs. Some of the jobs, like medical assistants, for example, aren't reviewed every single year or every time someone leaves. So it's incumbent on us to make sure that the leadership of those roles are reviewing that every couple of years to make sure that they are consistent with what they're doing, no matter the level. Thank you.
Thank you for that. Really a quick follow-up, and I will take, there's two managers. If there's new positions, and you don't have to answer right now, that are created that would never existed at Central Health, so we would like to learn about the review process and how you come with that.
It's the same process that we do currently. It's really assuming the job description, doing the market analysis based on the job description, and then setting the rates for that role before the role is posted.
Okay, thank you. I know that Manager Valdez had something quick and Manager Motwani. So do you want to, before we wrap this up?
My question was, and it was just a follow-up basically to what Ann brought up, and one of the reasons it was a preface for what I was asking about, but basically an analysis of the population that we serve, and looking at comparing that to our makeup from the top down, to make sure that we are in fact reflective of the population that we serve, because it's we make policies, whoever is in the roles dealing with them. So I just wanted to make sure that we understood that we're looking at it with that perspective, that lens. Thank you.
Thank
you don't get that unless you have that information.
Thank you for that. Manager Motwani.
Thank you. I wanted to comment on two things. The first is that fantastic presentation. I really appreciate the level of detail. And I wanted to, the notion of the level analysis that y'all do, meaning years of experience, and going back and bumping up if a staffer or staff member actually attains those years of experience is very, very important. And I appreciate that that's there, because that's one of the tricks of salary oppression, is that you enter an organization kind of at a salary level, and you're pigeonholed into there, and you get that maybe bump, a cost of living bump or whatnot, and a possible pay rise. But folks are coming in as time goes and as inflation changes, or it changes inflation, value of the positions increase, and you have sort of these folks who are stuck, and that creates this intrinsic salary inequity, which is a fantastic trick that's used to keep folks paid less in the private world and even in private nonprofits. And so, to the point of the Chair Kitchen on equity analysis, which I still think is very important. A lot of that need is mitigated, and I see a lot of organizations having to do an equity analysis because that's not sort of infrastructurally built in there. And so you'll have like a new person, and they may have different demographic characteristics that make it really, really unsavory that they're getting paid so much more than someone else who may be at a similar tier with maybe distinct demographic characteristics. And this helps to normalize that, though I don't think any single variable is going to eliminate all the need for equity analysis. So that's my first comment. Very excellent that y'all do that leveling, because it's extra work and it's super important work. Secondly, not here necessarily, but I do think it's important, given the changes at the federal and of course our dynamic state level, for if we could maybe get some guidance around what are statutory requirement, or I guess requirements, encouragements, as well as curtailing factors or boundaries, I guess, in as much as sort of what we can do to ensure fair compensation for all. So, thank you.
Okay, thank you so much. So, I am gonna wrap this item, and this is a start of a conversation. We'll come back, and thank you all members, and thank you Jeannie and your team. Thank you all. So, there's no motion for this item, and I think you will be happy that we are on, yeah, you know what, I try my best.
Very close on time.
Okay, I'm not gonna jinx.
Call it on time.
Oh, okay. I thought it was okay. So, managers, agenda item 5, confirm the next budget and finance committee meeting date, time, and location. Our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, February 26, 2025 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. I have a motion by Manager Valdez, a second by Manager, yeah. So, Manager Valdez seconded, yeah, okay. All in favor?
Aye.
Meeting adjourned. Thank you. Okay, good afternoon. Today is January 29th, and it is 4:57. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. I'd also like to announce that in order to make it more accessible to the community members, we'll hold public communication at a time certain of 5:30. I know we did it earlier, so we'll check again at 5:30 to see if we have any more. So we'll now proceed to the Executive Committee agenda. Managers, in light of our efforts to, we'll talk about this more, but in light of our efforts to be more efficient, we have budgeted time for the Executive Committee meeting to finish by 5:23. So if we can, keep that in mind. We should be able to go through this pretty quick. Okay, so the first item is approve the minutes of the Central Health Executive Committee, October 23rd, 2024. Looking for a motion from Vice Chair Vincent Princeton,
I move that the committee approve the minutes of the Central Health Executive Committee, October 23rd, 2024 meeting.
Second?
Second from Manager Martin, right? Okay, all in favor?
Aye.
Okay. Item number 2, review and provide direction to staff on the prioritization and tentative scheduling of items for the consideration at future Central Health Board and Committee meetings. So, Brianna and Perla will be presenting. I'm going to make one quick statement, and then they'll present on the schedule. And then I'll talk for a minute about some ideas we have on making our meetings efficient and timely. We will speak to y'all about, Perla and Brianna will talk with y'all about the retreat that's scheduled for Saturday, to give y'all a heads up on that. We also want to let you know that we heard you from Monday and from other days about the importance of getting our meetings scheduled with Iman and Associates as soon as we can. We have learned, Monica has been working on that today, and we have learned that we will be able to bring them to talk to the full board on February 26th. And so we will use that date to have a presentation from Iman and a full conversation where they'll be talking with us about the whole range of things related to the HRSA and the public center model. So if you want to speak to the retreat or anything else you want to tell us.
Why don't I start with the retreat? Just a reminder, we have a retreat on Saturday from 9 a.m. to 1 p.m. Brianna sent an update this morning with the pre-reads. We sent over a few documents, backup documents, or one backup document with everything, but it includes a visioning pre-work assignment, summary of the topics and breakout groups from the first retreat, and synthesis of the facilitated discussion. And in order to have a robust discussion on Saturday, including some, the first hour and a half will be board discussion, talking about, what legacy you would like to leave for the organization 10 years from now. We just asked if you could review those documents and come, prepared to share your ideas and your thoughts. Again, we'll start at 9 a.m. We'll end at 1 p.m. Any questions?
Yeah, I'll just add that we also, I had the chance to talk to, with you and with some of our board members about the importance of setting aside some time on Saturday.
Yes.
For the board to talk with each other about visioning. And so that's what we're doing for the first hour and a half or so.
Correct.
And that'll be the focus on Saturday. And then after that, we will have the opportunity to hear from our consultants and staff and Dr. Lee on challenges and issues and the types of things we need to think about as we grow. So that's how we've set it up for Saturday. Okay, let me go around the room. Do you want to go first, Maram?
Thank you. I certainly believe there's a lot to, the agenda's fully packed. Mm-hmm. So I think us talking as a board and then the consultants. So I don't know if we can really actually some of the substance matter that we're discussing. I would have hoped that we would have started with a board frank conversation and then had our consultants. That would have been more desirable than stacking it all together. So those are just primarily comments that I have.
Okay. Look, if you don't mind, let's start here, Manager May. Although, let me just ask, Manager Jones, do you have anything? You want to comment?
Yes, I would. I agree with Manager Mafaita with regards to the order in which we should look at those items, because I think the 4 hours or so we have is not going to be adequate, so we might want to look at other time.
Okay.
The other thing, I don't know, I'm not sure if inculcated in our plans is to also look at, not to compare, but look at and assess what other hospital districts look like and how they operate, so that we have something to compare ourselves to. Not that we need to follow those, but I do think that we need to understand some of the other methods and models that are in place. So I would encourage that as part of the discussion as well.
Okay. Manager May?
I would echo what Manager Jones just said too. But I'd like to just say that my experience from the first session was not what I had expected. And I would sure hope that the next session does not mirror that first session. I understand and I know that that it's important for us to have facilitators. I get that. I've been and done these many times for organizations I have led and those, of course, that I participate in. So I know there's various models on how to go about it and so forth. But that being said, I sure hope that I don't walk away from the experience this Saturday where I feel like the meeting and the retreat was contrived and that I felt manipulated. I just want to put that out because that's how I walked out last time. So I'm hoping that I can hear from my colleagues and that I can grow my understanding of where we're going together with, of course, our CEO and the staff.
Okay. Manager one?
Thank you.
Okay. Did you have anything else?
I concur.
Okay.
No questions.
Okay. Manager Martin?
Thank you. I would agree with Manager Jones. I think if we could increase the time, we're going to be here. I think there's so much to discuss. Mm-hmm. I propose that we should have some type of scribe that's following these ideas, because I think we need to stay focused on truly what our vision is. If we can concur on that, we can move forward. And I think to incorporate where we wish to go with input from staff as to where they think we can go and what we can do, so.
Okay. Manager Valadez?
Yes, I'd like to agree basically with what everybody's saying. That last, I don't know what that was. It was called a retreat, but I felt it was just for the benefit of staff or anybody else present. I did not, as a board member, get anything out of it. And when I asked for and I support I keep wanting to call Shannon doctor. I support Shannon 100% for a board retreat. To me, that means for us as a board to get our act together, for us to talk about what we would like to see at Central Health, which is why I agree with Dr. Martin. But I think we also need to understand where each of us is also coming from and how to communicate better as we, as board members, try to move forward through a very challenging time. And so I'm not here. I'm not going to be attending that meeting. I am going to attend it, but I don't want to sit there and listen to 3 hours of presentations and the board has 3 minutes to speak on what they want to do. No, I think we as a board should be prioritized first, and anybody else comes second. And there should be enough time to accommodate that. I'm just asking, because that's, again, up to you, Chair. But I think that the board members would like to make sure that our time is spent efficiently and effectively. And that way we can get down to doing the business that we're supposed to be doing and not going back and forth on the same issues here at Central Health in our board meetings. Thank you.
Dr. Zamora?
Same topic. When I ran our retreat when I was chair,
that's right.
We just ran out of time and then we tried to reschedule and just never could get rescheduled. So if we could set another date for another retreat in the future, because we're all busy. Every one of us is busy here, and it's hard to get 9 people in a room on a Saturday. So we can start thinking about the next appointment,
Okay.
Part two, exactly.
So what I'm hearing from folks is, well, let me ask you, do you have any questions about what you're hearing?
I think we appreciate the feedback, first of all. And I think there is a lot of information to share. And so I think we're trying to strike that balance. And I hear you about wanting to have, a discussion just amongst board. And we took that feedback and we've changed the retreat to allow for that. But I think, we hear you. We're trying to strike that balance between, listening, but also providing the information that you need to better understand what it takes to become a more mature hospital district, as I think we've been discussing. And so we will take your feedback and we will huddle and talk to consultants, and we'll do our best to accommodate everybody's interests.
Okay.
Yeah, I have one
Yes.
more comment. Segue into that, into maturing into a development system. I don't know if this is appropriate for that meeting, but I think to really sort of plan some type of trip
Yeah,
to
I agree.
review, but really put it down, direct staff to make the contact so we can actually make some trips and get the people we need to get on board, county commissioners, et cetera, to sort of strategize that. I'd like that to occur at this retreat, that we can strategize, because we're at this crux to move to a mature system, so that's all.
And Perla, I think that we talked about that after that first part or somewhere in there, we were going to talk about next steps. That being one of the next steps. You mentioned one of the next steps. Someone else did also in terms of needing more than one meeting. So if we could incorporate into our discussion on Saturday about next steps, the trip, setting another meeting, understanding that we're going to need more conversations, and whatever else comes out of our conversation on Saturday about next steps, of course. Okay.
Just really quickly, I definitely, I think when you're speaking about mature hospital district, it's great, but there needs to be a clear understanding of what central health is, what are we required to do, and what do we aspire, and then we can think about the future. But jumping into the future without even understanding alignment, I don't know if it can be feasible at this moment in time in the speed that you want. So that is something that I think you should think of it critically, and not to skip a step, even though we're visionaries, we want to do great things, but we need to take a step back and assess the situation and address the stakeholders who are really relevant to us. Their voice is necessary at this point as we move forward.
Okay, I think we're getting into the conversation we want to have on Saturday. So to keep us on time, I'll take a few more comments, including Shannon's. But remember, we're set aside the time on Saturday just for us to have this exact kind of conversation, as you mentioned, and also, it's for us to talk to each other about what is our vision. That's our job as board members, to set the direction. We do that in conversation with our CEO and our staff, but that's our job. So we have to have the time to talk to each other. So I'm going to take two more comments, and then I'm going to move us to the next item. Manager Jones.
Yes, I agree. All I'm saying is that I think we use this as a time to prep for where we're going. The reason I refer to other hospital districts is not that we want to remodel, we want to learn from what is out there to consider options we may consider or may not consider. And I think to start down the road of developing what we want to look at, it's better to also to understand what are the challenges other districts are facing and have faced, so that we won't make those same mistakes. That's the only purpose I have for that. And I agree with you, Saturday is a good opportunity to talk about the reasons we need to be doing some of those things.
Okay. Okay.
Mine was just to make sure that Dr. Sablon is about to pass out. He's wanting food. Oh, is there going to be food for Saturday? Okay, priority.
There's
priority.
breakfast and lunch and snacks.
Thank you.
And they accommodate everybody's
I know.
dietary.
Okay, so aside from that,
Okay, y'all,
wanna
I'm
make-
trying to keep us on time.
I want to
Go
make
ahead.
I want to make sure that, and I don't know whether this is possible, but I personally would like to hear for staff to give us like a little brief synopsis, or somebody, Dr. Lee, from both Community Care and Sendero, because we're an enterprise. And as we talk about our vision, we have to know, I'd like to know, what they think the vision is, and where are they going? How do they view us together moving forward? And I just like a brief synopsis on that. It doesn't have to be 5 minutes or 10 minutes, just a very brief thing. And I was just wondering.
Okay, so let us talk about how to do that, okay? I'll talk with y'all about how to do this.
Yeah, and it's a wonderful segue. We can do a little bit of that later tonight. And I'm to several of the manager's comments. I've had about a year to go out and listen, talk with a lot of colleagues, and I would love to share some of what I've been hearing, really to inform and contribute to the data set as you think through. So to the degree that it's appropriate for me to be able to be in dialogue and share as topics come up what I'm hearing from others, I'm happy to do that. It doesn't replace seeing. Seeing is believing, so I think the visit is a brilliant idea and we should do it, but I'd also be happy to feedback some of what I've seen in those visits and want to provide that information at the appropriate time.
Okay, that'll be helpful. Can we?
I'll make it fast, I
Okay.
promise. And to that point, Dr. Lee, when we go out to look at potentially some other systems that we are looking to maybe emulate or to possibly become, here's the other piece of that. There's a lot of team building that happens amongst us as board members and the staff that might be engaged. And if that ends up being the most important thing that we get out of it, that's going to be worth it. So I just want to say that.
Yeah.
Thank you.
And may I just, and I know we need to move forward.
Okay, go ahead.
But just very quickly, just to level set with everyone, super excited about the teaser of the collaborative work on, you know, some of the visiony stuff that's coming later tonight. And there is you know, over half of what's scheduled for Saturday is the you guys talking, us scribing, listening, absorbing all of that so that we can move that into whatever the next step is. We have to be very mindful of sunk time and expense from consultants.
Yeah.
And we have been planning since October with consultants that this is their last part of the retreat. And so part of it, they're going to do a reminder of information on, and just some high level information of what some of our peers look like in Texas, hospital districts, a little bit of what they gathered from y'all during the last retreat, and then some exercises about more information like what you are requesting, and also gathering information about what you think about that information. But there is a sunk cost that we have with this consultant that we would not be able to get that information if we don't do it on Saturday. And we absolutely will come back and plan additional time where there's time for you to talk, time for us to hear. All of the, whether we would go to Dallas or San Antonio or Houston, they have spaces where there can be those conversations where we can hear and learn and process what you guys are seeing and what you think is important. So we'll do more, but I would like to say at least there's, you know, and at least an hour and a half to get the information from the consultants and the time that's been, you know, kind of invested into bringing that together. And we thank you for the input, but, you know, we want to make sure that, you know, we utilize the expertise that we have while it's available. And
Yeah.
I think it'll be worthwhile.
Yeah, so it's
yes, we're paying for it.
Yes.
Yes, thank you.
Thank you.
We
So
hear you.
to
Looking
sum
forward to
up,
the
the
conversation.
first part is just us talking to each other, because we heard that we needed to do that. The second part is, as Monica described it, we'll hear from our experts. Okay, anything else, Perla?
I think Monica said it well, but, you know, I think depending on next steps, I think we can huddle again and decide where we go from there. I don't know if there's an opportunity to continue with these consultants, or maybe there's some other expertise we can access.
Okay, so the second thing that I wanted to bring up to y'all under this agenda item is just the, I wanted to share in like 2 minutes a couple of thoughts that I had and ways that we'll be proceeding in terms of setting our agenda and moving forward. And then ask you all to share your thoughts. And this is an iterative process. We've all recognized and talked about the fact that we've had a lot of meetings. We've used a lot of everybody's time, and that's challenging. So we have to balance and create the most efficient meetings that we possibly can, given the fact that we're growing and there's a lot to talk about. So there's a couple of things that I want to mention to y'all that I'm proceeding with, and then I'm sure you all have ideas. I would ask you to send those ideas to me and to each other, so that we can, as we go along, we can evolve how we have our meetings. So the first thing is something that Manager May pointed out to us earlier, which was a great example. Give us detailed backup, talk to us for 5 or 10 minutes, and then ask for questions and discussion. A lot of what we do, we can do that way. Not everything, but a lot we can. So that's going to help a lot if we do that. So that's one thing. The other thing is that and Dr. Lee may talk with us more about this later, but we will have a standing agenda item to hear from Dr. Lee. We can ask him for a written report, and you can do the same thing. Written report, 5 to 10 minutes, any discussion. So that will help us also. The third thing I wanted to mention to you all was the potential for, the third thing I wanted to mention was we will share with you when we lead our various meetings, the timeline. So we will pass it out for y'all. And again, the intention is not to suppress discussion, but to help us all understand that we're trying to stay to a timeline. So, so we'll do that also. The other thing I wanted to mention is we have a message board. And I'd like to explore further the use of the message board. We're not going to talk about it now, but we will provide more information about the message board. The message board is a way under state law to avoid quorum issues and to allow board members to talk to each other. That's all it's for. It's just for board members to post things that they want the rest of their board, you know. If those of you who are familiar with council, we did that all the time. It is not for attorney-client privilege stuff, because it's not privileged. The public can see it. So, but it is a way to say, hey, I was thinking about X. I think it might be a good idea. You can have a conversation on the message board doing that. It can save you time in board meetings, and you can also share documents that way. So we will, I'll work with the staff and we'll get some more information about what's possible. We'll set a time to talk about it. It is voluntary. You can use it or not. And it is a tool. So we'll talk about that more. And then, let's see, so those are the only things I wanted to mention. And then I would just ask that y'all think about it. I mean, you're going to have you already have ideas, and you've made various suggestions. So we're trying to incorporate them. So one very quick comment, because in one more minute we'll be back on time.
For some of us on the board that are 70 plus, still trying to figure out what that message board is and how to get to it. I'd appreciate training. Thank you.
Yes, we will have training. So, okay. All right, I'm going to move us on now to item number 3 on the executive committee. And that is confirm the next regular executive committee meeting date, time, and location. Managers, our next, I don't think this date is right. April. So our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, February 26th at 4 p.m. So, all right, at this time I'm ready to a motion to adjourn from Manager Musaitis, second from Manager Martin. All in favor? Aye. Okay. We will now go on to our Board of Managers meeting. Good afternoon. Today is January 29th, and it is 5:23. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. Managers, we have public communication scheduled for 5:30, so I'm going to see if we can take up one item pretty quickly and then come back to public communication, unless, do we know, is anybody signed up? No one signed up. Okay, we don't need to worry about that. All right. We'll now proceed to the consent agenda. Manager's consent agenda item C4 was already approved on Monday in our special call meeting, so we don't need that one. That one's the one that related to the CUC budget. So we have 3 items on our consent agenda. I am ready for a motion to accept the consent agenda. Manager Musaitis.
I move that the board approve consent agenda items C1 to C3.
Second. Manager May. All in favor?
Aye.
Okay, thank you. We'll now proceed to the regular agenda. So, members, we have part of item 1 in open session. We have item number 4 in open session. Item 2 and 3 are closed session. So, it's 5:25. I think that item number 4 is quick. So what I would like to do is go ahead and get that done. And then we'll go back to item number 1, which is the main thing that we're doing today.
Clarification.
Yes.
What happened with C5, which was a Sendero
C5? I don't,
I don't know what I'm looking at, but I thought it said Sendero, timeline, Sendero,
no, that
what?
would have been
Am I looking at the wrong thing?
Yeah, I think maybe,
There's only
there's no C5.
C4s.
I have approved the calendar 2025 budget for Sendero
We
Health
did
Plans.
that, that's an old one.
Okay,
We did that already.
so we did
You're probably
C4
looking at
and
the minutes.
C5. It's the one I just got today.
You're probably looking at previous minutes.
Okay, thank you very much.
Okay. All right, I'm going to take up item number 4. It's a public item. And I think that we can do this in about 10 minutes. If we discover that we need more time, then we'll come back to it. Okay. Discuss and take appropriate action on the appointment of a new Central Health Compliance Officer pursuant to Central Health Compliance Policy CMP-003. Dr. Lee will present, and then we'll have a motion just as background. And Dr. Lee, you may be speaking to this, but as background, the compliance officer is a position in our bylaws that that the board appoints. So that's why this is in front of us. So,
Don't
Dr. Lee, do you have something to present? I'm sorry. What?
Can we go to close? I have
You want to go and close in that? Okay. All right. Well, then what we'll do is we'll set this aside for right now because it sounds like we may have some
Yes.
questions in closed. Okay. All right. Well, let's go back to, I'm going to get us into closed session then. All right. Items, I'm going to read the items and then take us into closed session. Okay. Item number 1. I'm sorry.
Did you want to do the open portion of item 1 before closed as well, or just do it after?
Oh, good point. Do you have a preference? Okay, that would be fine. Okay, so item number 1 relates to, do you mind if I just set the, okay. So item number 1 is our item that is, where is it right here? Discuss and take appropriate action on the performance of the Central Health President and CEO, including activities and performance criteria for the upcoming year. So we have some items that Dr. Lee will be presenting to us in open session, and then we will have some items that are discussion in closed session. So, and for everyone, this is just a follow-up on the evaluation that we did last time. We had asked Dr. Lee to come back to us with some ideas. We also have this current fiscal year's evaluation criteria that we will need to think about and adopt. And at the appropriate time, we can ask Jeannie to talk to us about that process. But first, let me turn to Dr. Lee. Any questions about how we're proceeding from anyone?
Chair, when you say think about and adopt, are you suggesting that the thinking, so that the adoption wouldn't be today of the new criteria?
No, we
Okay,
need
that's
more
what
time.
yeah, that's what I figured.
But what we're thinking to do, and I'll ask, do you mind if I have Jeannie? Jeannie, would you come up and just talk, where is she? Oh, okay. Well, when she comes back, basically, she will need time to hear what Dr. Lee is proposing and also to hear from all of us on what we would like to see in terms of criteria. Then she'll distill it for us and bring it back to us, we think, on February 12th, so that we could approve at that time the criteria, the evaluation criteria for this year. Okay? Does that answer
That makes
your
sense,
question?
yeah. That's what I thought, I just wanted to confirm.
Okay, all right. Want to go ahead, Dr. Lee? Yeah? Yeah, go up there. I think we can see you better.
Good afternoon or evening, managers. Chad Kitchen with appreciation for keeping us, I think, exactly on time or even slightly ahead of schedule. Want to begin by wishing everyone a happy Lunar New Year. Year of the Snake. I was born in the year of the Snake, so happy Lunar New Year. And also want to acknowledge this is day 1 of year 2 for me on the job. So really honored to have been here for a year together, and appreciate the opportunity to be able to come back after reflecting extensively on the very helpful written and verbal feedback that the board provided at our last meeting. And so what we wanted to do actually today, we've been hard at work over the past few weeks digesting that feedback. And two of the most important kind of items that we believe will improve on some of the items, so we actually wanted to demo them for you in open session because we think they are, I hope you find them relevant, and we actually want to show you and then talk about them as part of a comprehensive set. So the first item.
Dr. Lee?
Yes.
I'm sorry, I should have asked you at the beginning. Is it correct that you need about 30 minutes for this part?
I think that's correct, 30
Okay.
to 45. It depends how much discussion there is from the board, but the
Okay.
verbal comment section, will be briefer than that.
Okay.
All right, so if we could go ahead and pass out the open session CEO update item. And so what I wanted to do here is first orient you to what this is and what the purpose is, and then we'll go ahead and run it. And so broadly speaking,
I'm sorry to interrupt you again. Have we sent it to Manager Jones?
let's do that. So we will send it right now. Thank you for reminding me of that. So this is a CEO update meant to be a monthly, robust line of sight for the board on what's going on now and what are some of the key emerging issues, both outside and inside the organization, and to provide that in a consistent, structured way that allows the board and the public to kind of know what to expect as we work through these sections. There will always be an open session component, and depending on the content, there may be a closed session component to some of these items, and they'll be marked as such, but the open session component will become part of the record so that we know what was discussed, and so that is the intent here. What I want to state up front is that we welcome your feedback. The intent is to provide you that executive overview of the current state and the key issues. And so please let us know what's working for you. I want to also acknowledge that multiple people have been hard at work to produce this first beta version for you. It's not going to be perfect, but we welcome your feedback. So there are 6 standard sections that we are proposing, and I'm going to just walk through the 6, and then we'll go ahead and take them through in order. So standard section 1 is called Priorities and Key Results, and the tagline here is to provide focus on board-directed strategic priorities. Section number 2 we're calling the Leading Edge. The idea here is that we are a system in constant evolution, at least in the current state. So what are the new services, innovations, and partnerships that are occurring that the board may wish to be aware of or celebrate? Section 3 is called Emerging Issues. So what are the opportunities and threats on the horizon for board awareness? Typically, these are going to be external opportunities or threats of significance to the board. We don't want to worry alone. We want you all to worry with us on some of these issues, or push us to capture opportunities. Section 4 we're calling Outside Inside, and this is a people-focused section, recognizing there are many people in our community who have a vested interest in what we do, and there's people inside our organization, and really we think of this as one continuum, so outside, inside, with a people focus. Section 5 is called What We're Solving For, and let me know if you hate this tagline, but I was torn between sausage making and a view to the factory floor, but to give you a window of the level of problem solving that is occurring around some key issues. We obviously can't cover everything, but we'll select a few key issues so you can kind of look onto the factory floor and see what we're solving for. And then we will land with the, I think, justly popular mission moment, why we do what we do, which has been a standard feature under Chair Kitchen's leadership, but we're going to incorporate that into the 6-point update. So with that in mind, the intent is for us to provide sort of a structured verbal overview over all these issues, and then really take questions at the end. But you have this one page as a place to grab your questions or points as we go through, and then we can go in the round. And hopefully, Manager may know this will feel like an efficient way to cover quite a lot of ground that is hopefully board relevant. And as I said before, if we are missing the mark, then we welcome your feedback and we will adjust. Okay, so starting at the top, that first bullet point of priorities and key results, and this is the segue from your invitation, Manager Valdez. So I am very delighted to report that just before the holidays, for what I believe is the first time in our history as a central health system, the top executives of Sendero, CommuniCare, and Central Health locked ourselves in a room for the day with facilitation from our wonderful Chief Transformation Officer and Chief People Officer to try to think about the future, not just of one of our organizations, but of our entire system. And for those who've been part of these kinds of gatherings, this is often not a productive exercise. And we knew that going in. We thought just being together in and of itself would be important. But I am delighted to report that despite all that we have come through recently, this was a day where about 18 of our top leaders across the system were able to work through a remarkable amount of ideas, hear each other, come to alignment, check, would this make sense for our respective boards based on what we know the mission, vision, and known priorities are, confirm that at least we believe, and let me say this is provisional because you're seeing this for the first time, and obviously we will need, we welcome your feedback, so we could have this wrong, but all the executive teams felt that the core priorities that we were identifying were consistent, maybe highly consistent with where our boards want us to go, and this is a place where we can connect and have one unified set of system priorities that we would all work together toward. And what I want to do is name those priorities for you and then invite up our wonderful guide in this journey, Kim Hyen, to say a few more words around that process and what comes next. So these are the 5 priorities. Priority number 1 is to foster an exceptional shared culture across the system. This is the we are strongest when we are one trunk, many branches notion, that if we do not go together with a shared core purpose and an honoring of our many diverse branches with trust, then we're not going to go very far. So foster an exceptional shared culture is number 1. Priority number 2 is to build a comprehensive, equitable healthcare system. Our world-class city deserves a world-class health system for everybody. And we all believe in that deeply, and there's a lot of work to do, but we put that right up there on the page to strive toward. Priority number 3 is to create seamless and simplified patient care journeys. This is about end-to-end patient care across all those islands of care that we know about so well, where our patients may fall through the cracks and get hurt, or be stuck in a loop with many delays, and those delays can cause harm and even death, depending on the delays. We know that all too well. And it's part of the promise of an integrated system like ours that we can actually link all those pieces up together. It's part of the vision. And so creating seamless, simplified patient care journeys is number 3. Priority number 4 is to empower and develop our people. Our people power all of this. We were talking about this earlier today around the total rewards. That's a very important part of the overall notion that nothing is more important than our people. So let's focus on that. And priority number 5, which I'm particularly proud of the team getting here because I think it's very well framed, is to demonstrate the value of community support. Demonstrate, we have to measure, we have to communicate. Value, quality plus service over cost. So the outcome and the experience over the cost. What do we get for what we spend? Community. Our people, our community, our stakeholders, our partners, our elected officials, there are many forms of that community. And support, the public dollars that we have the privilege and the responsibility of channeling toward better health. So demonstrate the value of community support. And so really proud of those 5 priorities. I can't wait to hear your thoughts when we get to that section. And I want to invite up Kim Heinen to say a few words more about the process and what's to follow.
Sir, I'm sorry. I could not understand the last 2 words of your item number 5.
Demonstrate the value of community support. Oh, okay. Yeah, community support. Thank you.
Madam Chair, I'm sorry to interrupt, but is there an attachment to this outline, or is it just the outline from which the CEO is speaking?
I think it's just an outline, right?
It's just the outline, and we're experimenting with this, so we'll provide the verbal updates high level, and we can talk about questions. If more backup is desired, in the future, we welcome that feedback, and we can provide longer memos, but we thought we'd try a high-level executive through line for this go-around, but we welcome your feedback.
That's fine. I just want to make sure I'm not missing anything. That's fine.
And Dr. Leah, just a question. I think I understand, but to tie this back to our agenda item, our agenda item is for you to respond to, it's 2 things, for you to respond to the feedback on the evaluation, and then also to provide your ideas around criteria. This is related to the first part, right? You're demonstrating to us how you propose to respond to some of our evaluations.
Yes, this is one of
Okay.
The responses and recommendations, and I will sum that all up together in our
That's
closed session
fine.
item.
I just wanted to understand. So the conversation, the reason I'm saying that is the conversation about the priorities is we may not have time to do that part tonight because, well, anyway, we'll come back to it. That's really more of our retreat conversation. And rather than for us to get into a conversation today about the priorities. So, okay, go ahead.
Chair Kitchen, managers, good evening. I made a presentation in a previous meeting about a system that leading organizations are doing to execute their strategy. So management by objectives or objectives and key results. So really taking big challenges, strategic imperatives, and breaking those challenges into smaller and smaller challenges and have the entire organization participate in solving for those. This type of system will align and accelerate the execution of system-wide strategic imperatives that have been set by our boards through current strategic plans, budget resolution priorities for fiscal year 2025 that were developed between the board, input from communities we serve, and staff recommendations. This type of system will also provide a way to measure how we're progressing towards those priorities. While the management system and collaboration between the joint executives are new, the priorities are not. So we spent a day together with the executives and keeping health equity as our joint aspiration. And then we came up with these 5 priorities for the enterprise. And they reflect, the 2025 priorities set by our respective boards. So this is not something we came up with. So we aligned those with the strategic imperatives. And I want to just pick, what we're doing now is, Dr. Lee communicated the 5 priorities. We also, as a joint team, came up with key results for each of those priorities. And I just want to share one so that you kind of get a flavor of this. So priority number 2, build a comprehensive, equitable healthcare system. So the first key result is establish an ambulatory access and quality plan by the end of Q3. And that will then be given to another team. They will take that as their objective and break that down even further. So just kind of an example what a breakdown for that team could look like. So access to care, availability of services, appointment scheduling, transportation and accessibility, and those would then be the pieces that they would work on, and even break down further, give those to other teams to work on. And then the last, demonstrate the value of community support. So this is one of the key results that the team came up with. Improve health outcomes by 20% as measured by appropriate quality measures by focusing on food insecurities by the end of fiscal year 2025. So my point here is that, you know, this work is in complete alignment with the joint board strategic imperatives and priorities.
Okay, do you have a question or?
Well, I just wanted to, it sounds to me like, you know, to both the CEO and the chair's point that these are so I appreciate the structure and of course at a high level, but it sounds like these are umbrella notions that are proposed and that key results are examples that, you know, and then that we would, you know, look at that and flesh that out in a deeper conversation. Is that what that sounds like?
That's what
Okay.
that's what I'm understanding because the board hasn't adopted these.
Yes, so we're only proposing. So these are proposals
okay.
how we want to work together as you know, joint executive teams, and those, you know, then would be part of Dr. Lee's work that he presents.
Are these proposed as part of your evaluation criteria? Is that what these
Yes,
are?
and we'll circle back to this point and connect it to the evaluation criteria in the closed session component. But you can think of this as upgraded version of the early wins for trust that we used last year. So we're going to do that. I'll add that this is not all that we're going to do. Clearly, there's a lot of work that's going to happen, but these are going to be some of the important things that we're going to do in alignment with our colleagues across the system, and will be the lead-off item to every month's open session CEO update, so that as the board reflects on these and determines are these we want you to focus on these board-directed strategic priorities. These are the most important things in the midst of all the chaos and noise, and we want to hear about this every month, so we know how we're doing, you know, where we're excelling, where we're getting stuck, why we're getting stuck, what we're doing about it. And so we will be able to provide greater clarity, you know, greater understanding of continuous improvement that's needed and occurring, and a greater understanding of alignment as we work side by side with our community care colleagues in particular on the access and quality plan for the ambulatory care across the system. For example, that would be inclusive of primary care and specialty care, access and quality, and the connection between the two. So that's a biggie, right? It's just one little line, but by the end of Q3, we will strive to have a plan for how we put these things together. And if it lands on our strategic priorities and key results, then that will be a subject of update to the board every month. We might not cover absolutely every component of this, but there will be substantive updates. So this is a way for the board actually to direct, hey, focus here, right? And then we will turn that around with an update every month. Here's how we're doing on the most important things. So that is the intent.
Okay. I'm looking at the time. So is there?
So let me keep going on the other items here, if that's okay. Thank you, Kim. All right. And this was a bit longer today because we're introducing the format. We're introducing, once we're all kind of up and running, we know what to expect. We'll just step through in a much more expeditious way. Okay, so we're down to the leading edge Bridge Mobile Phase 3. So as you recall, there was a Phase 1 that was in clinic in Capitol Plaza next to our specialty care. There was a Phase 2, which was connecting to ATC EMS. And then this is Phase 3, which is actually being able to go mobile out to sites that need us, anywhere that needs us in the county. That launched on January 9th of this year. In total, to remind the board, Bridge provides a full range of service that our most vulnerable and often unsheltered neighbors need, including medical care, PCP appointments, specialty visit appointments, hospital follow-ups, administrative support. Patients may walk in with no MAP coverage, have a 2 to 3 hour visit, walk out with their MAP card. That happens consistently. Food stamp renewal and others. Clinical services, blood draws, pap smears, oftentimes a women's health exam for the first time in decades. That was our very first patient, if you recall, Gigi. Health education on smoking cessation, flu vaccines, cancer screening, hypertension, etc. medical supplies, ankle braces, over-the-counter medications. So very comprehensive whole person care for our most vulnerable. And then upcoming locations for the mobile services. In February of this year, we will be at the Integral Care Diversion Center in Hungry Hill. In March of this year, we're going to add the Texas Harm Reduction Alliance. In April of this year, we'll add Foundation Communities Waterloo. And then one notable win that I want to share for this service, you may recall that when I began my work last year, one of the first things I did was round with our homeless services team in the Arch to see in respite a young man, a young black man who had been homeless in his car. Had frostbite, had both his legs amputated. It was difficult and heartbreaking. 2 years prior, he would have been discharged to the street. At this point, he was discharged to respite in a scattered bed at Arch, which is a big step forward. But I'm delighted to report that this year, the night of Martin Luther King Jr. Day, remember that was the cold snap day where we shut down services. At 7 a.m. on MLK Day, there were 3 vehicles parked outside of our bridge clinic from EMS and police. And individuals have been picked up overnight who were out in the cold and were brought to us at 7 a.m. where we tucked them in. Everyone had all of their limbs intact. So this is the work that we are doing, and we've made a lot of progress in this year, and I just want to thank the teams. Okay, moving on to the next item, integrated facility design. This is the notion that form drives function. The space that we are in can shape how we communicate, how we collaborate, and whether the intended work to be done is facilitated by the space or perhaps inhibited by the space. And we recognized a time-limited opportunity to look at the future headquarters of Central Health in Hancock. Many of you were at a groundbreaking, and we are in construction already. So this is a real time-limited opportunity. But to ask for that large 90,000 square foot clinical space, have we set it up for success so that a patient feels really taken care of and the space just takes care of you, flows you to what you need. Someone greets you when you walk in, and the team is set up for clinical flow and teamwork collaboration. And on that second floor, which will be the future system leadership headquarters for our system, the nerve center, if you will, that helps remove barriers and ensure that all is proceeding well across the system. Is that space set up for collaboration amongst leadership, visibility to the problems that we need, potentially a place where the public could come and see us do our work and feel reassured that if you all working like this at the headquarters, I can feel more comfortable that all the things behind the curtain that I can't see are running just as well. So that is what we did. This was downstream of that joint executive retreat that I mentioned to you in the earlier update. We now had VPs and directors from Community Care and Central Health, as well as a few senior leaders in the room. Sendera was invited, but they had 30,000 enrollees that they were dealing with, all hands on deck, so they knew they weren't going to be there. They apologized, but they were focusing on making sure to tuck in 30,000 people. We are now in the process of, I should share, one exercise that's done in this integrated facility design workshop early on is to have everyone express what are you hopeful for, what are your wishes, and what are you worried about, what are your fears. And typically, the fears column outweighs the wishes, hopes column. That's just normal in these things because it's pretty unusual. And what I will share here is the wishes column was about twice as large as the fears column, which is quite remarkable. I haven't seen that in an IFD workshop, and we had consultants who run this practice nationally, and they really complimented our team for how ready to do this work they were, and we had some wonderful insights from that team that we are now running up against. What can we do? What should we do? What's the work plan involved? All the necessary practicalities and alignments. So more work to do there, but I'm really delighted for that start. We will likely bring back more details to the board, but that's the high level that happened. Emerging issues we will touch on in the closed session update. Going to outside, inside. We have community conversations teed up. Please mark your calendars. You can see the dates and times there for precincts 2, 4, and 3. We are scheduling 1. We will get it scheduled. And as you know, these are a cornerstone of our efforts to engage directly with our stakeholders. They provide a unique opportunity to showcase how taxpayer dollars are making a tangible impact by funding care for people with low income in our community. They also allow us to address questions, listen to concerns, understand the issues that matter most so we can follow up and build that into our budget season. An innovation from last year that we will continue this year, and thank you to all of you who participated, is to have an opportunity for board managers to directly listen and engage with our stakeholders. That was very well received last year. Next up, congratulations are in order to our very own Perla Cavazos. She is now our Chief Governance and Government Affairs Officer, a very well-deserved elevation. And this is reflective of Perla's role in developing and ensuring government affairs strategies are aligned with the overall system's mission and goals. She'll continue to operate in the external affairs dyad with the wonderful Ted Burton, our Chief Communications Officer. Together they are external affairs for the system, and continue to serve as a valued key advocate and voice for the system and the community. And then it is with heavy heart that I share that I accepted Mackenzie Fraser's resignation last week. We sincerely appreciate Mackenzie's many contributions to Central Health over the past 4 years, including his dedicated service on the Sendero Board of Directors. To ensure continuity and minimize the impact on the compliance team, we're in the process of engaging a consulting firm to provide a fractional executive to serve in an interim capacity. The firm will also review our current state and provide recommendations going forward as the system grows and our needs evolve. And during this interim period, I would like to recommend, this is coming up in item 4.
Yeah, you don't need to mention it now. We'll
Okay,
get
so
to
we'll address
that.
it. We'll address it in item 4 in closed session. Okay, moving on to what we're solving for. This is the view to the factory floor. If you prefer sausage making, I can change the CAG line. But 3 things here. We are working to add Central Health's direct practice service lines to the Sendero network. And we're working collaboratively, both our staff. These service offerings will initially focus on existing Central Health patients who have transitioned to Sendero coverage, as well as prior MAP and MAP basic patients enrolled in the high-risk CHAP expansion program. And then we will open availability to the broader Sendero enrollee population in a future phase. So that's an exciting integration across major components of our system. Second view to the factory floor here is around operationalizing medical respite and clinical services at the Clinical Education Center. Many of you are part of the tour at a recent infrastructure committee. Just want to update that multiple Central Health teams are focused on operationalizing medical respite beds, as well as dedicated clinical services for the respite population at the CEC, with a planned Q3 or Q4 fiscal year go live, including construction, development of policies and procedures, hiring of staff, contracting with support service vendors. Central Health recently executed a consulting agreement with the National Healthcare for the Homeless Council to advise and assist us with developing those policies, standard operating procedures, and related planning efforts. And finally, we are developing the first system-wide coordinated safety plan. So our staff are convening a team inclusive of community care, Sendero, and Central Health leaders and subject matter experts to ensure that we have a coordinated safety plan that is consistent across the system. This includes both clinical and administrative locations with an emphasis on coordinated responses in our shared facilities. And I want to thank Stephanie McDonald and her team for helping spearhead this effort with the assistance of many others. And then last but not least, our mission moment, why we do what we do, Danielle's path to recovery. We want to go ahead and share that mission moment with all of you now, and then we can open up for any quick questions on this. Thank you.
I was unable to do a lot. I couldn't walk. I couldn't walk normally. I had to wear a boot to protect it. Life wasn't 100%.
So Danielle is an amazing 36-year-old female that came to my clinic as a referral, and she just ran out of options. Nobody could figure out how to manage that ulceration. because what happened was she had developed what we call a Charcot arthropathy, usually caused by diabetes. That's part of the causes of Charcot.
When I came in to visit, he took a look at my foot and said, "Let's do this." And so within 2 months, I was back to normal. My foot was starting to heal, and now I'm starting to walk.
So basically, I mean, why I'm excited about her case is because, you know, she's basically what Central Health represents. And I'm glad that we're able to provide the care that she needed to be able to go back into the community and continue to function and walk around and feel important.
It was a pleasure seeing him, and I'm grateful that I had the opportunity to meet him and to get him to help me, because now I don't have a hole in my foot, and that's amazing.
Excellent.
All right, so thanks for bearing with us through our first run through. I'm sure there's room for improvement. Welcome your questions on any of these topics or your feedback on the tool. And of course, we can continue to get your feedback after the meeting as well.
Yeah, what I'd like to do is we'll go around the room. And so Dr. Lee, thank you for demonstrating to us, because I'm understanding one of the things you're trying to respond to is, people wanted communication, and this is a way. So I'll go around the room and see if people have any feedback, and we'll start with Manager Jones. Now, what I'd like to suggest, given our time, that we focus on feedback about the tool first, so that we're giving Dr. Lee feedback on whether this kind of tool will give us the communication that we have been asking him for. So I'd ask y'all to focus on that first. We will have more conversations about the 5 areas, and we could take some feedback on that too, but that's not really the focus of what we're talking about right now. So I would want to just be careful on the time on that, unless that's intended to be what we look at for evaluation criteria, in which case we need to give feedback on that. But let's do this. Let's go around the room first and give Dr. Lee any feedback on the tool itself, and then see where we're at on time. Does that make sense to everybody? Does that make sense? Okay. Let's start on this side this time. Okay, do you have any suggestions? Does this tool? Okay. Manager Valadez?
I like this for a jumping off point. I personally would like to have get into the conversation on the performance evaluation so I can ask him directly about communication deficiencies with respect to our system, to this board prior to today. And I just want clarification. Did you say the bridge phase 3 mobile launched today?
It launched on January 9th.
Oh, January 9th. Okay, thank you.
Okay. Dr. Martin?
Yeah, I want to thank you. It's a very good presentation. And I really would just like to emphasize to you and thank you and for the board for the concept of the continued monthly feedback on this mission as we proceed. I think that's just vital. Thank you.
Dr. Brinson?
Yes, I like it very much, as long as we stay, that we hear from month to month a continuation of what we heard before, so that we're not changing, topics all the time.
Yep.
Manager Musad?
Thank you for this. This is a good start. It's a draft. I see, also what I'm really interested in really understanding some of our quality metrics and how you're measuring it and what we're currently doing, not just what we're aspiring to do. How can we do better for what exists right now? And I also want to see additional board communication, some type of communication input, because you talk about emergent issues. So how are those going to be presented? So some of the concept of open communication would be helpful. So we can go into further discussion in our closed session, but this is a good first draft. Thank you.
Okay, Manager Martin.
I think this is fantastic. I'm looking forward to having a standing item where we can hear this, and I also really appreciate sort of a distilled format. I think a lot of the items that we talk about can fall under one of these categories that that then we can discuss, and I appreciate the notion that we'll be able to communicate around these ideas as they're presented in these subsets. Also, I just wanted to see if we could maybe read out loud the dates, just Chair, if that's okay,
Sure.
the dates and times of the community conversations.
why don't you go ahead and do that?
I'm happy to do that, just in case anybody, all the listening fans out there. March 5th of 2025, from 5:30 to 7:30 p.m. is Precinct 2 community conversation, and you can follow up on our website for the site, the location. That's March 5th for Precinct 2. April 3rd, 5:30 to 7:30 p.m., Precinct 4. May 7th, 5:30 to 7:30 p.m., Precinct 3. And again, to repeat, Precinct 1 is TBD. Please follow up with us before, obviously, March for the sites. Thank you.
Thank you, Dr. Lee. I appreciate the time that you took to put this together and the response, and I do look forward to seeing how this is going to evolve. I feel like I still need time to kind of work through this and see, if I fully understand if this is going to get to some of our concerns earlier. I know you're open about tweaking things, and so that's always a good thing. There are a couple of items in here that I'd like to defer for closed session.
Okay.
But beyond that, I'm gonna reserve the right to still think it through and see that this is what I thought we might need as a board. Thank you.
Okay, Manager Jones?
Yes, I'd like to join my colleagues and thank you, Dr. Lee. I think this is a good start in terms of an outline. I want us to be consistent, though, in doing it. Each meeting that we follow that format. I also think that we need to be sensitive to the time frame, even to the point that we need a time clock, because I know we have a tendency to go on and on and on about topics that are ongoing. But I think this opportunity to share this on a routine basis that board members would benefit greatly, and the public as well. So thanks very much, and I'm very supportive of it.
And Dr. Lee, I think this is very helpful, and I will see how it proceeds and how it evolves, and people may have more comments. I have two thoughts about it. First off, I see this as a written update with a, like Manager Jones said, with a spot on the agenda. I see this more as a 10 to 15 minute presentation. And if there are items that need more time or that need board discussion, then I see us putting them actually on the agenda. This is not a substitute for the agenda items that we might have. It's your report. And so if it's like the first one, well, anyway, if it's an item for board feedback, board discussion, board approval, or any kind of vote, then we'll do it as an agenda item.
Yep.
So, okay.
But Manager, just Chair, just saying that and doing that is what's going to be key. So I think as Chair, you're going to have to keep us in line when that report is given, because we have a tendency to go off on comments or items that have been presented. So I just want to emphasize that, so that once we begin, we would know that this has been acknowledged.
So that's a wonderful segue, Manager Jones, because I'm now going to take us into closed session so that we can, thank you for presenting this.
May I briefly confirm the feedback to make sure that it's clear I've heard, and then we're also gonna, just briefly, 30 seconds.
Well, we need to go into closed session. What were you trying to do? You just want to make sure you heard people?
Confirm the feedback.
Okay,
so, just briefly, good start, reserve the right to improve, good feedback.
Okay.
Consistency, month to month, so that is the intent that these 6 sections, unless you ask us to change them, will be consistent as category headings, so you'll know what to expect month to month. Quality metrics, Manager Saitief, will be embedded in number one. That is really the intent, is to, as we drill down to access quality plans and so on. But yes, there should be data that you will begin to see. There is a companion closed session component of this, which we will do once we move into closed session. So there often will be two components. I can commit that I will keep my remarks to 15 minutes going forward. There won't need to be a preamble as there was today. And then it'll be the chair's discretion of how much discussion we engage in following that. But I will commit to stick to 15 minutes in my verbal remarks.
Yeah, and we'll talk ahead of time, as we always do. If it's an item for discussion, we'll put it as an actual agenda item.
Yes.
This is intended as update.
That's right. That's right. Yeah, and I completely acknowledge that point, right? This is not.
Okay. All right, we're going to move into closed session now, and let me read the, okay. We're going to go into closed session on items 1, 2, 3, and 4. David, do I need to read 1, 2, 3, and 4? Yeah, okay. Item number 1 is discuss and take appropriate action on the performance of the Central Health President and CEO, including activities and performance criteria for the upcoming year. Item number 2 is receive and discuss a briefing regarding Travis County Healthcare District DBA Central Health versus Ascension, Texas, FKA Seton Healthcare Family. Item number 3 is receive and discuss a briefing regarding Birch et al. Versus Travis County Healthcare District DBA Central Health and Dr. Patrick Lee. Item number 4 is discuss and take appropriate action on the appointment of a new Central Health Compliance Officer pursuant to Central Health Compliance Policy CMP 003. The board is convening in closed session to discuss these items. Agenda items 1 and 4 under Texas Government Code Section 551.071. Consultation with attorney and Texas Government Code Section 551.074 personnel matters. And agenda items 2 and 3 under Texas Government Code Section 551.071, consultation with attorney. Okay, we're going to move. Today is the 29th, and it is 6:12, and we are going to move into closed session. So I would ask everyone to leave the room for closed session, with the exception of Jeannie Verdon and our attorneys. It is January 29th, and the time is 8:03, and we are entering open session. And we're going to item number 4, which is discuss and take appropriate action on the appointment of a new Central Health Compliance Officer pursuant to Central Health Compliance Policy CMP 003. Members, we have a memo in backup recommending Monica Crowley as our interim compliance officer. Do I have a motion?
I so move.
Second.
Okay.
Then we ask the questions.
Yes, now that for discussion.
Okay, so
Wait, let her make the motion.
I move the board appoint
I
Monica
did.
Crowley as the acting Central Health Compliance Officer.
Microphone.
All right, y'all.
Thank
We
you.
have a motion from Manager
Second.
Brinson, second from Manager
Elisa
May.
May.
Now, let me just say that we have some more conversation that we want to have about this, that we will have on February 12th. What we are doing tonight is, our motion tonight is to appoint an interim compliance officer. All in favor?
Aye.
Aye. Any abstentions? Any noes? Okay, all right. I'm now ready for managers. Our next Central Health Board of Managers meeting is scheduled for Wednesday, February 26th, but what we have determined is that we will need to add a full board meeting on February 12th. February 12th is our Strategic Planning Committee, and so we will also add a full board committee to finish up the things that we did not tonight. So do I have a motion to adjourn?
So moved.
Moved from Manager May, second from Manager Martin. All in favor?
Aye.
Aye.
Okay, thank you all.
Thank you.